Sorry.
Like just seborrheic keratosis.
Yes.
We can ask for STI, that is sun, trauma, and insect.
Yeah, sun trauma insect test. Yeah, that's fine. So let's do it again. So let's say it's a squamous cell carcinoma. Let me try it. Okay.
Yeah.
Again, 2 or 3 minutes, I'll try to do it. So again, the structure would be, I'm going to write the structure. Findings, correlate findings with history, explain diagnosis. So you need to explain finding as well. Diagnosis, check patient understanding, check patient understanding, check patient understanding. After that, check. After that, mention urgent treatment or urgent referral, treatment options. Before that, you have to do the best case scenarios and worst case scenario. That was missing.
Yeah. It was like that.
Reading material, safety netting. So let me try it now on this structure. So this structure is basically the structure where you have to do the management, because if you follow this structure, less likely you will fail in management part. Because this is your, if you see your GMC exam scorecard, the finding, diagnosis, there is a tick, tick, tick. So how you are going to explain, that's the most important thing. So you don't need to rush over that. So let's start. Michael, I have examined you, and after having a brief chat with you, let me briefly explain what I have find on your examination part. So I have examined your nose. I can see there is some ulceration on that, and you're bleeding on that part as well. And if I correlate your finding with the history, you mentioned that you have family history of skin cancer, and you're losing some weight, and I could find some lumps and bumps if there is a finding or not. Okay. Putting all these things together, at the moment, I'm suspecting something serious related to the skin. Yes, skin have some condition which are simple infections or lesions or moles, but at this time, I'm afraid to tell you, I'm suspecting cancer of skin. And that cancer we call squamous cell carcinoma.
Oh. What are you going to do now, doctor?
I'm sorry. First of all, I need to explain a bit more about that. First of all, I would like to tell you I'm suspecting at the moment, okay? So let me explain to you what squamous cell carcinoma or cancer of skin is, okay?
All right.
It is a serious condition which can happen due to some changes to our skin. Our skin cells can change. And there is another thing which I would like to tell you. We need to treat it because sometimes that it can spread to other part of the skin as well. Okay. For that, we need to refer you to the skin specialist. Okay. Who is going to see you in the 2-week times. Okay.
All right.
He will do further specific investigation to confirm it.
All
Okay.
right.
It's not confirmed yet. Mr. Michael, I would like to tell you, everyone who's sent to this 2-week pathway not always end up into having cancer.
All right.
But the good thing is that I want to appreciate you came here today so that we'll catch it up as soon as possible. I would appreciate for that. So what would happen next? Are you with me? Okay.
Yes, doctor.
This is what you was not expecting.
Yeah.
I want to explain everything to you slowly, okay?
All right.
First, specialist is going to see you in 2-week times. Okay. You're happy to see the specialist?
Yes, doctor.
Do the referral, okay?
All right.
Anything for you.
Yeah, that's fine.
The next step would be what the specialist will do. He will take the sample, biopsy we call it, from your lesion, okay?
Yeah.
That biopsy would be assessed. For example, in best case scenario, if it's not cancer, it would be treated as what it is, okay?
All right.
But worst case scenario, again, don't worry, there are a lot of options are available for the skin cancer as well. Okay, those options would be radiology, some rays, some chemo through the veins, and excision of that skin cancer as well. Okay, before you go, I would like to give you reading materials, and this time already finished. So basically, the management would start with the finding, explaining diagnosis, checking understanding, urgent treatment option, best case scenario, worst case scenarios, reading material, and all that. Guys, you understand? You have any question? So this is how you will go with the management.
Zeeshan, sometimes we don't like it.
Sorry.
I'm like my voice is echoing.
Yeah. Yes, Nida.
I was just wondering, like, do we have to tell that it's a squamous cell carcinoma or the basal cell, because it came in it was
Not
one.
important. It's not important.
So it was, it can take the extra seconds from your management. It can.
Is what I would say. Sometimes examiner want to hear.
But usually it's a
So sometimes I've seen the patient, they cross the diagnosis. I've heard from a lot of my students that my diagnosis part, they cross me on my diagnosis, because I would highly recommend whatever you are suspecting, say the name.
All right. And if you're not, then maybe
if you're not, then skin cancer. But if you're 100% that's ulcerated, is like something like, say, squamous cell, then explain what it is. Because sometimes patient want to know, in my real setting, in the setting, sometimes patient want me to write, can you please write the name for me, that I will Google it and search it, but you are suspecting. So this is the patient concern. Sometimes patient want to know the name, but you're suspecting.
Yeah, right.
You have to tell that anyway. But if you say skin cancer, that's totally fine. That's totally perfect. So in the skin part, this is what you need to know, the specialists. So urticaria can come as well. So in the urticarias, nothing syphilis is in the already in the female health. You already might have done.